Now I have the pleasure to introduce Fernando Alfageme, dermatologist from Madrid, Spain. I know that he practically introduced cutaneous ultrasound in Spain, and I was very happy when he accepted to be part of the team. Please, Fernando, you will talk about skin ultrasound and nail ultrasound. Please.
Thank you very much for your kind invitation. Well, I am Fernando Alfageme from Spain, and I'm the most extra-articular part of this consensus that we are having today. I was in charge of the skin ultrasound and with several colleagues, Michaela and Levent, and I think we did quite a good job regarding this application of ultrasound that it concerns mainly the outer part of the world, of our body. The skin is the most extensive organ in our body, and sometimes we have in several occasions we have musculoskeletal diseases that affect the skin, and diseases of the skin that affect the musculoskeletal system. Nowadays, we consider skin ultrasound as part of dermatologic ultrasound too. Dermatologic ultrasound is a wider ultrasound application. We have recently released our own recommendations in EFSUMB that I suggest you to read regarding a wider view on this new application of ultrasound on skin, hair, and nails that also will be a part which we will talk about today. As I told you, musculoskeletal diseases may affect the skin, and sometimes the skin affects the musculoskeletal. There's no wall that separates each worlds. We tend to communicate because sometimes we can solve the problems of the patient with very good communication between dermatologists that are dealing with this superficial part, and you, most of you that are dealing with a deeper part. As in the rest of musculoskeletal ultrasound, skin ultrasound is complementary to the clinical examination and histopathology. It's one of the complementary tests only, and has to be taken into account in context, always in context, together with the clinical examination that in dermatology is very wide and it's very complex because everything is more or less the same. It's red, but the different tones of red together with the informational ultrasound and another imaging technology leads to a final diagnosis. Then it requires corroboration of all the available information of the patient and knowledge of skin diseases for the management. Common application of dermatologic ultrasounds in general would be the assessing of normal skin and skin aging. That's more the aesthetic part of dermatologic ultrasound that we are not dealing today. Inflammatory skin diseases, that's what we have more in common with you in musculoskeletal ultrasound regarding infection, hidradenitis, and sclerosing diseases such as morphea, scleroderma, and scars. And another enormous world then in the dermatologic ultrasound world that will be skin oncology. There are lots of skin cancers, but we can divide them mainly in melanoma skin cancer or non-melanoma skin cancer. Then we always have to take into account the clinical image with the ultrasound image. And then the newest equipments allow us to mix them in a single image so that we have all the information just to make the differentials. From the practical point of view, the minimum frequency for this kind of exploration, it would be 15 megahertz with linear probes, and that we can explore most of the skin. However, for this exploration of the hair and the nails, we recommend a higher frequency, a higher resolution. Skin ultrasound should always be performed without direct contact. We tend to work on the gel, or with a gel pad, to evaluate the initial part that is an epidermal line. That is very important for us too. Then significant amount of gel is recommended, and also, as in any application of ultrasound, longitudinal and transverse scanning are mandatory to assess three-dimensional measurements. Color or power Doppler is also necessary in all lesions for detection of neovascularization that is relevant not only in inflammation, to detect hidden inflammation, in the deep inflammation, in the deep inflammatory pathologies, and the evaluation of neovascularization in malignant lesions. It's very important because a benign lesion may be very similar to malignant lesions, with the only difference of this neovascularization. The main limitations nowadays are the resolution of our techniques, of our equipment and our techniques that only permit us to assess high magnification of the skin. The epidermis is a limit for us today. Dermis is very well evaluated, and subcutaneous tissue, as you know, is very easily is examined with ultrasound. Then the future use of high resolution frequency probes and equipment will be of help in this regard to assess more diseases related to the skin. Then we produced some recommendations regarding this application. As you will see, the level of evidence is not very high in dermatologic ultrasound. We are quite new in this world of ultrasound and applications of ultrasound. Then there are several diseases that, however, have been dealt in depth in our world, because ultrasound is very useful. For example, hidradenitis suppurativa, in which ultrasound is recommended in guidelines nowadays, EFSUMB guidelines and dermatologic ultrasound guidelines and hidradenitis suppurativa guidelines, with a level of evidence too, and recommendation is strong, with a strong consensus, 97%. Then hidradenitis suppurativa would be one of the most explored diseases in the skin with ultrasound. Also, the detection of skin abscesses is in ultrasound would be the first line modality, as you really know. The level of evidence is 2. The recommendation is strong, and there's also a strong consensus. And in the case of a scleroderma patient, both localized on systemic scleroderma patient, ultrasound is recommended for the qualitative and quantitative evaluation of skin layers and differentiation between disease forms, staging, and monitoring of skin normalities. And we also have to deal under the direction of Esperanza with nails. That is another part in which we are, this dermatological ultrasound application and musculoskeletal applications have points in common. The common applications in which we use this nail ultrasound in dermatologic ultrasound would be inflammatory nail diseases, psoriatic onychopathy, nail oncology. We use it for evaluation of nail tumors and other diseases of the nail. In this case, we recommend a higher resolution, moreover for the evaluation of the nail matrix area that is very, very small and nearly slot structure that needs a very high frequency evaluation. And we recommend a systematic evaluation of the nail in all its parts: nail plate, nail bed, and nail matrix area. Also, this color Doppler or power Doppler is necessary in our reports to assess the inflammatory status of the nail unit. The main limitations of this technique in the nail are the inter-server in inter-equipment variability and in the assessment of this structure, and mainly in the thoracic nails. That is the area of the field where there's more evidence. Then regarding recommendations, ultrasound may be useful to increase clinical diagnosis accuracy in structural infectious and inflammatory vascular nerve disorders. The level of evidence is very low. However, we use it quite commonly in common practice because it's very, very difficult to see farther from the clinical exploration without ultrasound in this kind of diseases. The use of ultrasound is also considered to support psoriatic onychopathy with a very low level of evidence, but however, we use it in clinical practice, also with a broad consensus. And also, it's the first line modality to assess subungual tumors, such as glomus tumor and exostosis, and may support the clinical diagnosis and help in surgical planification, also with a low level of evidence and also with a strong consensus. Thank you very much for your attention.